Hello, today I'm going to discuss Lyme disease and what you need to know. So Lyme disease is a vector-borne disease that is a disease that begins in another organism and is carried to humans. And is caused by bacterium Borrelia burgdorferi and is transmitted to humans through the bite of an infected black-legged tick. Infections produce fever, headaches, fatigue, and characteristic skin rash called erythema migrans, and can spread to joints, the heart, and the nervous system. So first documented tick-borne illnesses were in Europe in the early 20th century. In 1975, there were reported cases in Old Lyme, Connecticut of juvenile and idiopathic arthritis that were linked to tick bites. In 1976, Yale's Steer and Malavista surveillance study in Lyme, Connecticut confirmed associations of tick bites and arthritis and coined the term Lyme arthritis. In 1982, Burgdorfer and colleagues in Shelter Island, New York, discovered Borrelia burgdorferi colonized in the midguts of Oxytis scapularis. So, most commonly reported vector-borne illness in the United States, and it infects approximately 30,000 people per year. The incidence has doubled over the last 10 years. And in terms of a distribution on the left lower corner, you can see that children and elderly adults tend to be at higher risk for contracting this tick-borne illness. And on the right corner, we can see the distribution of prevalent areas where the tick is known to carry the disease. And as we can see, northeastern United States is very high. So the transmission, the Oxytis tick may be infected with Borrelia burgdorferi during any of its 3 stages of its 2-year lifespan. There's a larva, the nymph, and the adult stages. Nourishment for the tick requires a blood meal. So in late summer, the larva feeds on small animals such as the wood-footed mice. In the spring to summer, the nymph feeds on animals, and this is where humans are able to catch the disease. And during the fall, adults feed and mate on deer and transmit the eggs to the surrounding areas. And also, they feed on humans. So in this depiction, we can see, starting at number 1, we can see the adult female that drops her eggs, typically into leafy areas. The eggs hatch, and then the larva attach to mice. From there, the larvae molt into nymphs, where the nymphs can attach to other mice, attach to humans or other large animals. And then the nymphs molt into adults, where they can still attach to other animals and lay eggs. So signs and symptoms, there are 3 clinical stages of Lyme disease with different manifestations. So stage number 1 is the early Lyme disease. As many as 80% of patients develop a characteristic rash, erythema migrans. It's usually a single lesion that is uniform erythematous, oval to circular rash with a medium diameter of 16 centimeters. Approximately 19% of erythema migrans rashes are bull's-eye rash in appearance, as we can see in the picture. Associated symptoms are similar to nonspecific viral illnesses, fatigue, malaise, fever, chills, myalgia, and headaches. In stage number 2, which we call early disseminated disease, the bacteria enters the lymphatic system or the blood and has cardiac symptoms such as arrhythmias, dermatologic symptoms where you have the multiple erythematous migrans, musculoskeletal system where you have arthralgias and myalgias, and neurologic symptoms, lymphocytic meningitis, facial nerve palsies, and encephalitis. In stage number 3, we have a late disseminated disease, and these typically happen with untreated patients, and is most common site of the arthritis, which is a monoarticular or oligoarticular arthritis, which is either in one joint or multiple joints. And we also have the neurological symptoms like encephalomyelitis and peripheral neuropathy. So here we see a depiction of the signs and symptoms. So we have flu-like symptoms, the insomnia, psychological complications like depression, dementia. We have hearing loss, paralysis of the face, heart complications with rapid or slow heartbeats, syncope, which is fainting, hot and swollen painful joints, rashes at the site of the tick bite, or we can have multiple rashes, depending on the disease state. So the diagnosis of Lyme disease remains challenging since most patients have flu-like symptoms. Clinical diagnosis is straightforward if the patient has a history of the tick exposure and a characteristic erythema migrans rash. So there are different methods for cultivating the bacteria. We have the direct method, which involves culture and is the diagnostic standard for detecting the Borrelia burgdorferi species. And we have the indirect method, which involves serology to detect antibodies. The CDC recommends doing a 2-tier protocol with an ELISA and a Western blot. High-risk groups, people living in or visiting the northeastern United States, Minnesota, Wisconsin, northern California, outdoor recreation like hiking, camping, and climbing, and outdoor workers like forestry and landscaping. Prevention, tick exposure can occur year-round, but ticks are most active during warmer months, from April to December. So before you go outdoors, know where to expect ticks. Grassy, bushy, and wooded areas, or even on animals like your pets. Spending time outside, walking your dog, camping, gardening, hunting, could bring you in close contact with ticks. Many people get ticks in their own yard and neighborhoods. Treat your clothing and gear with a 0.5 permethrin solution on your clothing, or you can buy permethrin-treated clothing as well. Use insect repellent containing DEET, and avoid contact with ticks, avoiding woody areas, bushy areas, and walk in the center of trails. So here's just another depiction, how to protect yourself with Lyme disease, as we have discussed in the last page. So prevention continued. After you come indoors, check yourself and check your clothing for ticks. Tumble dry your clothing for at least 10 minutes on high to make sure that we kill the ticks. Examine gear and pets. Carefully examine pets, coats, and day packs. Shower soon after being indoors. Shower within 2 hours of coming indoors. And then check your body for ticks after being outdoors. We conduct a full body inspection. And here is how. So we want to check the hair. We want to check the ears, underarms, belly button, the waist. The legs are the most common areas, specifically the knees and above, since the ticks tend to crawl up through the pants. So in terms of managing individuals that have been infected, we have antibiotic therapy available and supportive therapy for the other symptoms, the flu-like symptoms. So depending on the age, we will use different sets of antibiotics. And for those with delayed treatment, they can lead to serious systemic side effects involving the joints, the heart, and central nervous system, and require intravenous or IV treatments with antibiotics such as ceftriaxone and penicillin. So here are some frequently asked questions. I've been bit by a tick. Do I have Lyme disease? So transmission of bacteria takes 24 hours from the time of attachment of the tick. Remove the tick with tweezers to make sure that we don't leave any parts behind. Can Lyme disease be transmitted sexually? No. Can Lyme disease be transmitted through breast milk? No. Am I pregnant and have Lyme disease? I am pregnant and have Lyme disease. What's next? See your doctor for up-to-date recommendations. Here are my references. Thank you.